Everyone, let me welcome you to the what is turning out to be the annual October speaker series on Medicare. I'm Carolyn Rourke, and I'm the current board chair of LowLink. It's a real pleasure to welcome Poppy Foddrell back again. She was with us last year. Poppy is the aging support coordinator for the Rappahannock Rapidan Community Services Board, which is also our region's area agency on aging. Among her many duties with RRCS, Poppy works to ensure that Medicare beneficiaries in our service area know how to navigate Medicare processes, including the rules and the important dates and costs. Each year during the open enrollment period, which we have just entered, she and her colleagues help to present prescription plan enrollees to get the best plan for their needs. Poppy is a graduate of Radford University and has been working in the human services field since 2003 in Prince William and Fauquier County Social Services Department, and now with RRCS. She's a passionate advocate for Medicare recipients, and she's the only person I know who can make this particular subject not only informative but fun. So
I don't know if fun is the word, but thank you, Carolyn. And thank y'all for having me back again. I appreciate the re-invitation. Jenny Zamora was supposed to be with me. She is the support coordinator for aging services in Orange County. Unfortunately, her father passed away over the weekend, and so she is in bereavement, but she wanted me to bring information and paperwork. She wants to meet with anybody that's interested. I have a paper. You guys can leave your name and number, and she will call you and make an appointment without any problem at all. I just wanted to let y'all know that. She really wishes she could be here, but she can't, so I am sure y'all understand. Okay, so this program, yes, is so near and dear to my heart. I am the coordinator of the VICAP program for our agency, which is the Virginia Insurance Counseling Assistance Program. It is something that is funded through the federal government for all area agencies on aging. Everybody that's an area agency on aging throughout the entire country gets a little bit of money to help educate and inform Medicare beneficiaries free of charge of all the information you need, all your rights and the rules and all the plans, so you can make your best decision for your own healthcare needs. We are not salespeople. We don't sell insurance. And I want you to be mindful, there's lots of people that are selling insurance around. They even go to the food banks and things, and they're sitting there, at least in Fauquier, they're sitting there selling their plans. And I would just caution you, after this presentation, hopefully you'll know a little bit more of what you have, what you might lose if you change, and things like that. I know right now they are marketing heavily for Advantage plans. It is like, it's everywhere. It is, the federal government is pushing this, it's pushing it hard. And there are benefits. It is unfortunate where we live as a rural area that it's not always as beneficial as it would be if we lived in a larger city. Come on in. Hi. No worries.
I couldn't find you.
Oh, it's all right. It's all right.
Oh, where's the sign in? It's over here. I can get them in at 3.
And we'll talk about those Advantage plans. So, as a whole, Medicare is a nationwide program. If you have original Medicare A and B, you can go to any provider in the entire United States that accepts Medicare, and they will bill Medicare. If you have a supplement, then the supplement will be billed, and that's how it works. Advantage plans are based on where you live, the zip code that you live in. So it sort of limits your options as far as providers. If you have homes in one place versus another, it might be, if you're like a snowbird, or you want to make sure whatever Advantage plan you have works here as well as wherever you live in another time of the year. So it's really important to know. So with original Medicare, people usually, when they turn 65, if they can afford it, they're sold a supplemental plan. The supplemental plans are what covers the co-payments and co-insurances that Medicare doesn't pay. So for open enrollment, to make it further confusing, I mean, I don't think they could make this any more confusing and they can continue changing things. I think it's to help us stay on our toes. I want to remain positive because it is very frustrating, the ads and the things that happen. So when you first have your Medicare and you got your supplement, the open enrollment period is not for those supplemental plans. In the state of Virginia, even though Medicare is a nationwide program, each state can sort of govern their supplements a little bit differently. So in the state of Virginia, once you have a supplemental plan, once you've bought your supplement through Medicare, you will probably have to go through medical underwriting if you want to change that plan. So it's so important to know that open enrollment, even though it doesn't say it on TV, nor does it even say it in the literature that they send me. I brought these things because it talks about your yearly Medicare plan review. Nowhere in here does it talk about what that means. So everybody assumes, because that's all of your medical insurance, that you can change that during open enrollment. And in the state of Virginia, that is not true. The only thing that you can change during open enrollment is your Part D drug plan or your Advantage plan. Now you can definitely at any time shop for another supplemental plan. That is definitely your right to shop for another plan. However, just know that the plans are going to ask you medical questions in order to determine if they want to cover you, because they don't have to. It's a supplemental benefit to your Medicare. And unfortunately, they can be, your height and weight ratio can't be within the limits that they pick, or they can look back in your medical history to determine, well, this doctor thought that you should have this surgery, but you opted not to, so why didn't you do it? And it's amazing what information they have about you just by your name and your Medicare number. So it's really important to know that. I know that Medicare is pushing these Advantage plans, and they would be really great. They might be great for some people, but make sure you know your rights before you change, because if you change to an Advantage plan, you might not be able to get your supplemental plan back. Or you might pay more for the same plan that you had before. It's really unfortunate, but it's an important thing I want everybody to know. Because I've heard more about Advantage plans this year than I ever have. People have called about Advantage plans because they're touting these zero plan copays and zero this and zero that. And who doesn't love zeros? Zeros are fabulous. However, when you're trying to find a doctor that accepts this insurance, that's what you have to be careful of. And unfortunately, these two Mary Washington plans are both HMO plans, which mean they require referrals to see any doctor, any provider, any specialist. It could be a fabulous plan, and I'm hopeful that it will be one day. But I think that an HMO plan is really hard sometimes to find providers. So I did a little digging since Carolyn asked me to talk specifically more in depth about those plans. And I printed out the information because I would never be able to remember it if I didn't have it on paper. And so yes, there are two plans, two zero premium plans. One offers additional help they can help with transportation and things, but each one of them, each one little thing, it says limit supply, physician referral required for physical therapy, speech therapy, outpatient therapy. For every additional benefit, a referral is required and limits do apply. It won't tell me much more about this information. Through the plan finder, it is best to call them, and I did. I called them today because my boss happens to live in Fredericksburg, and so she got a letter, and maybe you guys have gotten a letter about your Medicare Advantage plans that are available through Mary Washington. And there is one of these plans, the rewards plan, apparently can also reduce your Part B premium. So I was very interested to find out how they were going to do that. Because the federal government, who manages your Medicare and your Social Security, they automatically take that out of your Social Security check every month. It's an automated thing. So I called them to find out what that meant. And the lovely lady I spoke to, named Mia, was not sure. She did tell me, she said, because I said, so does this mean that the plan, Mary Washington Advantage plan, is going to pay directly to Social Security to make up that $50? And she said, well, yeah, I believe that's how how it's gonna happen. And so I'm sort of on the fence about how that's gonna happen. My boss and I were talking, and we think that it would be easier if they sent everybody like a $50 gift card or $50 something, because I don't know if y'all have ever worked with Social Security, but it's not always the easiest thing, and I cannot imagine that somehow they're gonna work with the Mary Washington Advantage Plan to reduce people's Part B premium. Although, I think it's a wonderful thing, I think it's a great thing. I don't think we should have to pay those large premiums to begin with, so any help will be great. So, I'll have to find out more about that, because the lady I spoke with, she wasn't quite sure, and I'm anxious to see what happens as this goes forward. I also tried to find the Mary Washington Advantage Plan website to see what sort of providers were in the area so I could give you a little information. And so I did just a general search of internal medicine, family practitioners, whatever, just a general search for Orange County. And so the closest providers, and I did like a 50-mile radius, so the closest providers are in Fredericksburg and Stafford, which probably isn't terribly far. That was the only thing that I looked for, because I was interested to see how close these providers were to where you guys were living. And so if you wanted, and you might already be driving to Fredericksburg and Spotsylvania and Stafford, I'm not quite sure. But I did do that, and there is a website for it. You can search, it's Mary Washington Advantage, I believe. I didn't write it down, I should have. But if you search, it'll come up through Google, it'll come up, and they do have a page where you can search and see all the providers, which is something I would encourage that everybody does if you're interested in switching to this plan. Make sure your drugs are covered from this plan, and make sure your doctors accept the plan, because it's silly to switch to a plan that you can't go see your doctors. And HMO plans, which is what these both are, you have to use in-network providers, no matter what. There are no out-of-network benefits. If you go out of network, you can just already say you're gonna pay 100% of that cost, because that's just how they work them out. I don't know why. Now, there's also, this year, forgive me, I have 5 counties, so I'm just trying to remember who has what. The only county that did not change, sadly, was Culpeper. Culpeper still has just one Advantage plan for everybody. It's just one. This year in Orange, there are 6 total plans, Advantage plans available. 2 are Mary Washington, the rest are Humana, and 2 of the Humana plans do not offer drug coverage. So if you are needing a plan that incorporates your drug coverage, you don't want to switch to one of those, because it's not going to give you any drug coverage. And then when you try to switch to a drug coverage, it's going to kick you out of that Advantage plan, because you can't have an Advantage plan and a drug plan. It's so crazy how they've done this. Not only that, did they changed the plan finder. I don't know if you guys ever used the plan finder through Medicare.gov, but it looks totally different now. And they did it right before open enrollment, which I cannot thank them enough for doing that. It just started in September, so we're trying to learn all the new things. They have updated it some with all the complaints that they've received across the country for the SHIP counselor, so it's getting better, I can say that. Printing it is a little challenging, but it is what it is. We have to go with what we have. So for the drug plans, specific drug plans, Part D, there's 29 plans available now this year. There were 27, well, there's 27 this year. 2020, there's going to be 29 plans available. I've looked at some of them. I do know the premiums that have changed. The cheapest premium, so if you take no medicines, you might want a cheaper premium. They're $13.20. The most expensive premium is $75.20. And the deductible has gone up from a maximum of $415 to $435. And now there's only 4 plans that don't have a deductible. Even SilverScript has a deductible now, which has been the plan that doesn't have a deductible consistently, and now they have a deductible. Now, deductible is not a bad word necessarily. It totally depends on the plan that you are enrolled in and the relationship they have with the pharmacy. Because some plans, if you're an in-network pharmacy and the plan itself, if you have Tier 1 and Tier 2 medicines, you don't usually pay for those medicines towards the deductible. But if you get Tier 3 or higher, or these fancy schmancy brand name drugs that are all over the TV, I know I talked about it last year, I'm still talking about it. these drugs that are on TV are really expensive. So those you're probably going to pay full price for until you reach your deductible. And then once you do, as long as it's in your plan formulary, your plan should cover part of it. The more expensive the drug is to start with, the higher the chance is that you're going to be in the donut hole, which is the coverage gap, which means that if you're in the donut hole and you have brand name medicines that you're taking, you're going to pay 25% of that brand name cost during the donut hole. And they were supposed to be closing the donut hole, so I think closing it meant to get into the donut hole, you're going to pay that 25%. The problem is they've made it larger. They've made it harder for you to get out of the donut hole to get to the catastrophic coverage, so where your drug costs go down. But I have noticed that there are some plans that really work better with insulins, and so it's really important to, if you don't come see us, you can call 1-800-MEDICARE. They have round-the-clock people, 24 hours a day from now until December 7th, that can help you to pick the best plan. Or if you go on Medicare.gov yourself through the Plan Finder, they are asking people to make a MyMedicare.gov account. Because if you do that, and if you have already done that, then you'll know, if you make a MyMedicare.gov account, Medicare.gov is a secure website. It's governed by Medicare and the government. And to enroll, it's really easy. You don't need an email address or anything. You just pick a user ID and a password. You have those questions that you have to remember. I would consider writing them down so you remember what the questions and the answers were. And then, so you'll be able to get back in. I'm just talking to myself because I have to do the same thing. Because everything requires a password, and usually questions, and I'm not sure who I'm talking about when the questions, so I have to write everything down. So when you do that, you have access almost real time to your claims as they've been processed. It shows you all the drugs that you've taken throughout the year. It's a great wealth of information through MyMedicare.gov. But so if you have one of those accounts, it's going to ask you to log in. If you don't, you can continue without logging in. Your information just won't be saved. So if you put all of your meds in and then you leave the computer and you come back in 2 days, it's probably not going to be there. So it is beneficial to do the MyMedicare.gov account, just so your information's there, you know it's you. It's easy to use your drugs, pick your drugs, slide them over, and then you can compare plans that way. That's how they've done it. They say, when I had the webinar with CMS, they said that they have changed it this way because it's more similar to online shopping, and they figured it would be a better customer experience to make it look more like that. So that's why they've changed it. They have finally added, at first it wasn't here, but so you can now, there's ways to sort, and you can pick, what the drug cost and the premium is going to be. It's going to calculate it for the entire year, which wasn't there when they first did this, and we all probably, I think everybody was on the phone to whoever their representative was to change it, because it's really important to know what your total cost with your premium and your, the cost you're going to pay for your meds throughout the entire year. Last year, when we did this during open enrollment, we saved people over $260,000. So, and every year it's gone up. I mean, every year we've been able to save people more and more and more. So I'm hopeful, I think I've said this before, I wish that we weren't here to do this, but I'm so glad that we are here to do this. It shouldn't be this complicated. It shouldn't change as much as it does, but it does. And so we are here. We are a free resource for you to call, to come in. Jenny, like I said, I have a paper, and she's happy to call you and make appointments for anybody that wants to come in. She has an office in Culpeper. She might even be able to make appointments at the senior center. I'm not quite sure, in Orange. But we really want to see as many people as we can to make sure that you know what you're getting. I'm so concerned that a lot of people are going to jump onto this Medicare Advantage who have a supplement plan and don't realize that's what they're getting into, and then they do realize it, and then they can't get back into their supplemental plan. That is my fear, and it's not as easy. Now, one positive, so let's say you do enroll in the Advantage plan with Mary Washington, or any Advantage plan, and let's say that plan stops being sold in your area. At that point, people that are in whatever plan it is that goes away will have a 2-month window to have guaranteed issue into a supplemental plan. There are some negatives. It was before that Medicare was choosing which supplemental plans you had guaranteed issue for. Now with the new plan finder, on the Medicare website, it had a really fabulous chart, and it would tell us, okay, so you qualify for a special enrollment for a guaranteed issue because of this reason, or this reason. But with the new plan finder, that chart's gone, and I can't find it. I've been looking for it. So I don't know if that means everything is gonna change, but there should be, if you say you do enroll in an Advantage plan, you wanna roll the dice, say this is what I'm gonna do. And if it goes away, you will have an opportunity at that point to buy into a supplemental plan with guaranteed issue. Yes.
Poppy, I
Yes,
think that, I went to the Mary Washington seminar on Sunday,
Uh-huh.
and I think the guy said, don't quote me on this, but that you had 12 months that you could switch back, but if you waited the 13th month, you're stuck.
Really?
Yeah,
12
that's what I
months.
heard him say, was 12 months. And then the 13th month, you're stuck.
That's new to me. I will definitely, I'm gonna write that down because I wanna research that. And when I find out when I find out, I'm gonna send it to Carolyn and then she can tell you guys what, because.
The other interesting thing he said, and I haven't looked at the Medicare Advantage, is that if you quote, move to a location that doesn't have a Medicare Advantage,
Mhm.
so you look on the internet and Pulaski, Virginia doesn't have a Medicare Advantage, if you quote, move there, qualify for a special enrollment.
Yes,
And then you can get back onto the,
true.
oh, that
Yes.
is true,
That part, if you move out of the service area or the plan leaves your service area, you do get a window for positive. That I know 100% is true.
Well, I heard him say this 12-month thing.
I'm interested to see if that's, they're paying part of your daggone premium, so maybe they can change those rules too. And I hope, that would be so great because it gives people a trial run.
Exactly, right.
To see. I'm gonna definitely check that because I would like to know if that would be great if it was.
So if they were gonna cancel, how much notice do they have to give us to let us know that they'll only cover us to a certain date?
Usually you get your advance notice by September of the current year,
Okay.
so you'll know what changes you need to make for open enrollment. Usually it's by September, usually. And then you have 2 months from either when you're notified or when your plan ends. So let's say you're notified in September, okay, this is gonna go away and you want to shop for another plan. Now the supplemental plans, you can't have a supplement and an Advantage plan together. So you can definitely shop during then and say, I want this plan to start January 1st. So that'll give you at least some leeway. Or if you don't find out, let's say you don't get your mail and you don't realize it till you look during open enrollment, it's when your plan ends, you still have 2 months, whichever date is later. At least that's what used to be on the chart that they took away. I'm hoping they're not changing all those rules that I finally have in my head. Somebody in the back, I think, had a question, but maybe it was answered.
Probably already answered this question.
Oh,
but
probably not.
What's the difference between those two, the supplemental and
Advantage?
Advantage?
Okay, so a supplemental plan is a private health insurance that goes along with your regular Medicare A and B. So you have Medicare A and B, the supplemental plans, and there's letters from A to N, and they cover different things, but they cover the co-payments, co-insurances, and deductibles that Medicare doesn't. Whereas the Advantage plans are a group health company that has replaced your Medicare benefits. So you're paying, you still pay the $135 from the Part B. This Medicare Advantage plan replaces that, and so you're in that plan's network of doctors. You have to see the providers within that network. And if you have an HMO, it's really specific to the network, whereas a PPO, they do have out-of-pocket benefits available. But I've noticed with the PPO plans, out-of-network benefits, you're paying 40% of what you would pay, where if you had original Medicare, you'd only pay 20%. So even there, it really doesn't benefit you. And if you have an Advantage plan, what I have learned, working with folks that have them, if you have a PPO plan that's an Advantage plan and you get your statements, I would review them, I would go over them with a fine-tooth comb, because they can bill you for out-of-network benefits that you're actually having in-network services. And I know this because they were doing it here in Orange, Humana, was, there was a lady that was going to the dialysis center, and she was going there 3 times a week. So she was paying her $40 copay every time she went, and for years, I mean, she was going for years. So finally, she came in one day and we were looking at it, and I said, well, why does this say out of network? So they were charging her out of network because the billing office they had was out of network, but the provider of the service was in the network. So, thank God she came in, because she couldn't get a supplement because she was on dialysis. There was no way any insurance company was gonna cover her. She didn't understand that that's not what she had. She thought she was buying a supplement when she bought the Advantage plan. She didn't understand. So finally, after going up the chain, we were able to get her thousands of dollars back. They did reimburse her finally, because the good thing about Advantage plans, they have an in-network and out-of-pocket maximum. So, you know, if you pay $6,700 in network out of your pocket, then the plan is supposed to kick in 100% of everything else. And so if they're not billing you correctly, that'll never happen. And the only way you know if they're billing you correctly is if you look at the statements. It is unfortunate this day and age, we have to be our own best advocate. Or if you aren't, please find somebody that can help you, because those statements, even with Medicare, you want to look at your statements. I provided some folders. Everybody by now hopefully should have a new Medicare card, the new card with your new numbers. If you don't, call Medicare or call Social Security and ask them to send you one, because the old one is only going to be good through the end of this year. After 12/31, they're not going to accept that old number with your Social Security number. It's only going to be the new cards. There's some really good pluses to that card, other than your Social Security number not being on there. They also, let's say you're a victim of identity fraud through your medical identity. Say somebody has gotten your Medicare number and they've started using it and billing you for all these things that have nothing to do with yourself personally. What that would do for you is, if let's say somebody's ordering diabetic supplies with your Medicare number, and you might not pay anything for it, but you're going to start to go to the doctor, and with electronic health records, they're going to see that you're a diabetic. And if you go to the emergency room, let's say, and you're unconscious, the doctors are going to believe that you're a diabetic, and they're going to treat you like you're a diabetic. So you have to be really careful on your Medicare summary notice that they bill you. They send you every quarterly, or you can look at it on your mymedicare.gov page. But you need to look at those bills. Well, they're not billed. This is not a bill. But those statements to make sure, number one, the doctors you're seeing are the ones that are billing you, and the services you've had are the ones, or the services you're being billed for are the ones you're being billed for. Because there's lots of these companies, or not even companies, people, fraudsters out there calling people to try to get your Medicare number so they can send you a back brace or send you things that you don't need. But everything you get added on that list then attributes to your Medicare. That's your Medicare health. So when you go to the emergency room, they'll treat you based on whatever is in your Medicare number. So now, with the new Medicare number, if you have been a victim of medical identity theft, they will actually change that number for you. So, which is really good. They can erase everything, you can start over, a new number, whereas before they couldn't do that with your Social Security number, because clearly they're not going to give you a new one of those. That'd be too much work. So, that's a plus. Yes?
Why is the government pushing the Advantage plans?
My guess is because if an Advantage plan is the one that's going to be billed and the Advantage plan is the one that's going to be paying for all of your services, the federal government no longer is through Medicare. So it takes away the burden of Medicare paying for services and things and puts it onto the companies that are now running the Advantage plans. That's my guess. I don't know exactly, I'm just assuming. But they're pushing hard. And everything I get is like, you know, this administration is really dedicated to lowering your costs, and we're doing all these great things. And yes, there are definitely more plans come and go, but it's so important to know what to do with those plans and to know that you have access to all of them and to look and see and make sure it's the best plan for you. I hope that that 12-month thing is true. That would make me like one of the happiest people in the world. Because why should you not? You know, it's like we're locked into this. If you have a supplement, you're locked into that plan. It's almost like you can't really switch it because... Unless you move to Pulaski. Exactly. Well, I'm telling you what, I had people who moved to Fauquier County. I'm the Fauquier rep normally. So they moved to Fauquier from Fairfax. They had Kaiser insurance. They loved their Kaiser. They loved to go to Kaiser. They had no problem still driving to Kaiser. And so some of them had other addresses, which they had kept for years, so they could continue their Kaiser benefits with their regular doctors. Till they move, then they've got to change their plan. And some people don't find out about it until they try to go, and they're like, well, you're no longer covered because you don't live in that service area anymore. That whole service area, I think that people should have a right to go where they want to go. Putting it into a network, it makes it really difficult sometimes to find.
3 other things about the Mary Washington Advantage. You may have covered this because I'm always late. But,
Probably
and I
not.
think this is important for Lake of the Woods people, is the only hospitals in network are Mary Washington and Stafford Hospital.
Oh.
So Culpeper, UVA docs,
Just Mary Washington and
Hospital
Stafford.
network.
Wow.
So, especially for people in Lake of the Woods, because half the people here go to Fredericksburg for care and half go to Culpeper and Charlottesville.
Wow, that's eye-opening.
And you may have said this, but Mary Washington has formed an alliance of physicians,
Oh, no, I didn't
and
know
I
that.
think that's who the participating providers are.
And they're in the Fredericksburg, Stafford area.
And they're mostly in the Fredericksburg, Spotsylvania area. And so like I moved to Fredericksburg from Lake of the Woods, and I go to Dr. Mussey. I've been going there for 25 years. He ain't joining the network. And so if I want to keep him, I have to pay out of pocket, or I have to switch to one of these, quote, alliance. Not quote,
They are.
they are alliance doctors, they're the
Okay.
only ones in network. So I think that is,
That's
and they're
such good
expanding
information.
it, you know.
Of course.
And what I heard, Fred Rankin happened to be in the class that I went to. And there's some financial incentives for the Fredericksburg doctors to join the alliance.
Oh. Oh.
And so there's more and more doctors that are joining every day because there's some financial, I used to say, follow the money and you follow the workflow.
Absolutely.
The doctors are incentivized
Wow.
to control this care.
Hmm.
So I think that's also an important
Yes,
thing.
yes.
And the third thing that was interesting, and again, you may have covered this, is the Mary Washington Medicare Advantage. Maybe all of them do this. They have 2 different programs. One's called the Rewards and one's called
Yes.
the Basic. And the Rewards is, if I understood it correctly, they give you $500 a year towards your Part B.
Yes, we did talk about that.
You did.
Did they say how they were gonna do that?
I was probably late for that part too. But they did talk about how they were going to do that. The other thing that's interesting about the Mary Washington, well, all of the Medicare Advantage, because there's huge financial incentives by the government to make these work.
Yeah.
Follow the money, you follow the money.
Yeah, and I swear
And
that's
so
what they want to do.
there's a marketing group that they have
Oh,
engaged
is
called
there ever?
Sunshine Network. And they are more than willing to come into your home and explain how this works.
Oh, I bet they are. More than willing. To set up wherever they can.
And it's also going to be managed outside of Mary Washington. It's going to be managed by
It's some luminous group or something. I saw that
I've seen
online
it.
when I was looking today. It's some group that's managing it. Yes, sir.
I just wanted to say, I have a Medicare Advantage plan with Humana, it's a PPO.
Yes.
I've had it, it's almost 4 years now, and overall, I've been really pleased with it. You know, they manage my drugs, the drug plan and everything like that. Most of the doctors that I've needed to go to, they've been there, been able to go to them. So there's been a lot of good benefits.
Good.
Now, every now and then, I'll get a drug that they were covering, and then for some reason or other, they dropped it and don't want to cover it. One thing I did do, I went out and got a Good RX card.
Oh my God, it's beautiful.
And I've used that to get around that,
Yes.
to cover the drug.
That's good.
And so it's, overall, I'm happy with it. So.
Good. Thank you for sharing that because I always love to hear positive because I always hear the negative. I hardly ever hear the positive. So that, and it does work. If you, and you have a PPO plan.
I have a PPO.
So you can go to doctors that could be outside of the network
Sure.
and pay a little more and you don't need a referral.
Yep.
Which is a positive. The PPOs are great. PFFS was a great plan too when they had it around. But those HMO plans, it's gonna be very interesting to see how they work with the deductibles and
A couple other positives to the positive point that I was impressed with, they include hearing aids,
Yes,
coverage.
there are
They
some, yeah.
include dental, and they include some vision.
Yeah,
So-
and-
silver sneakers.
Yes, they have
Yeah,
silver
silver
sneakers.
sneakers is great.
And so it does tell, so the rewards plan, the one that is gonna pay back to the $50 a month or whatever, they're the one, they don't offer transportation, but the Advantage Complete does offer some transportation benefits. And on here, and unfortunately, like I said, it's everything routine eye exam limits apply, $35 referral required, contact lenses, eyeglasses and frame limits apply. So I really feel like if you're interested in these plans, unfortunately Medicare.gov does not have everything on them, but if you call them directly, they're happy to tell you what they have. I'd feel so much better if that 12-month thing was true, and then you could switch and then you could try it out and see. I really love, oh my gosh, I can't wait to find out if that's true. I'll be sad if it's not, but you know, it's just like everything else. I'm trying to see, where's that one? I wanted to just see what it said about hearing aids on here.
It was like $895 for 2 hearing aids every 2 years. It was a
Oh,
very
that's
limited.
excellent. Because on here it says hearing aids, all types, 0 copay, limits apply. Then it says plan limits. There may be limits on how much the plan will provide, and that's all it tells you on the Medicare website.
About, like $1,000.
That's really good.
2 years.
That is a helpful thing. So, and let's just say that's true, and you have the 12 months, you can get your hearing aids and then you switch. No, I'm kidding, I'm totally kidding. I'm totally kidding. Because there was an insurance lady going around saying that that's what you should do, and I was like, why would you tell people to do that? And she was serious, like she said, you get these hearing aids with this other plan, and then you can switch to another plan after, and that is just fraudulent. I was kidding, reporting. Yes.
Now, I also wanted to say with this, I have this Medicare Advantage PPO. I have both the dental and the vision. The vision I've been very happy with, the dental sucks.
Yeah,
And so what I did is I went out and I got Delta Dental,
yep,
which is about $40 a month, and I've been happy with that. But the dental that's inside of this plan, no.
not good. And is it the one that comes with it automatically, or did you buy extra?
It's like $20 extra a month to put the dental and the vision, and even the high one. There's a couple of versions. Even the high one, the dental don't work, but
Yeah.
the vision does.
And this is, you have the
I have Humana PPO.
Humana regional PPO.
Mm-hmm.
So the next year, that premium will be $82. And I printed that one, I printed all of them out, because I figured y'all might want to know. So I have the information on your plan if you wanted to know what it was.
Yeah, I think it's like $23 to add on
For which?
Advantage, Mary Washington.
There's 0. There's no,
Both of them are
they're
zero.
both $0 premiums. 0 premiums,
And
0
Humana's-
deductibles. I'm sorry?
And Humana's 82 for the PPO.
82 for the PPO. And Humana Gold Plus is also an HMO that's available here in Orange. They have a $15 premium. $15 total. That just is the drug plan premium for that plan. So, but it's an HMO plan here as well. But yeah, PPO seems to, I mean, if you know how to work the network and make sure that they're billing you correctly, it seems to work. There's several people in Fauquier have the PPO plan and they love it. They would never switch to a supplement ever. So it can work, as long as the providers are on board. I remember when Humana first came out and it just seemed like they put the cart so far before the horse because they offered all these fabulous plans, but no doctors would accept them at all. And so you have these plans that are great, but you have to drive 3 hours to go to the doctor. It just seems, and how is that in my network if I'm driving 3 hours to find a network doctor? How is that in my network? So I'm hopeful, because it would be so beneficial. I am all about saving people money. I want people to not have to pay so much and go to places that you're gonna get great care. That's great information about those hospitals that are part of the network. That's good to know. That's really,
If you switch from an Advantage to another Advantage, Do you have to give all your medical history?
No, that's the great thing about Advantage plans.
Okay.
And those and your drug plans, I would say, don't get attached to them because they change a lot. They come and go every year. So no, you can change during open enrollment any year.
And the price is not determined at all by your age?
No,
So it's
Nope.
the same, it's like being 65 and signing up, huh?
yes, no
Okay.
medical history, nope. You just pay the premium and make sure your drugs are covered and yeah, you can use, yes, absolutely.
The only question that the Medicare Advantage, I couldn't hear Vicky's question, I thought was interesting, is do you have end-stage renal disease? That was the only question that they,
Yes, because if you have end-stage renal disease, you can't buy an Advantage plan no matter what. They won't let you.
but if you end up on dialysis, then
It's
it's
okay,
okay.
yes.
So that was
You
the
can't
only
already have,
question that-
it's so awful, you can't have that diagnosis, nor can you get a supplement. I mean, it's like you're out there and, yes, that is unfortunately true. It's awful. Yes,
I'm new to Medicare. I'm
Okay.
starting at 8.
welcome.
Is there any advantage for a couple to pick the plans together, or should you pick each plan for what's good for you as an individual?
Well, with Medicare, it's really your own personal plan. It's really based on your personal needs. So, and normally these plans are single coverage only, even with supplements. Now, if you have a supplement and you go with the same company, normally they'll give you a discount. But if you have an Advantage plan, you'll each pay the same price. It won't be any difference, and you'll have your own coverage.
Okay, now I'm gonna start in April. Do I have a longer enrollment period, or is my enrollment period to get on Medicare now the same as everybody's? To start on April 1st?
No, you'll have your own special enrollment. So in April, are you already receiving Social Security benefits?
No.
Okay, so you'll have to apply for your Medicare benefits 3 months before you turn 65 if you want them. And then you apply, they'll send you the card, and then you can shop for supplemental stuff or the Advantage plans, look at them all and determine where you want to go. We can send you all the information you need,
Okay,
or you can meet with us and we can show you all the options you have.
I was gonna make an appointment coming up and say, well,
Yeah, you can definitely make an appointment. I would say call, once you have your card, we can't enroll anybody without that Medicare number.
okay.
So once you have your card and you know when it's gonna start, like just to get just a standalone drug plan, we can enroll you on the very last day of the month to start the very next day. Of course, you won't have your card by then, but so I wouldn't wait that long, but you
No,
can.
I don't plan to wait, I plan to have
Yeah.
it all decided long ahead.
Yeah,
Now, and I was also told, and I just want to confirm, Medicare starts the first of the month on the month that you turn 65. So I turn 65 April 15th, but I can drop my insurance and start Medicare on April 1st.
yes, yep, unless your birthday's on the 1st, if your birthday was the 1st, it starts the month before that. But yes, everybody else, it starts the month you turn 65, so you can drop your insurance the month before. Well, the end of that month, yes, yep.
Okay, good enough.
Yes, and I'm so glad, I just remembered, so, oh my God. So I was here before and I was talking about Plan F and how Plan F was gonna stop being sold and yada, yada, yada. So, Plan F is still here, but it's only gonna be here for for everybody that has already been enrolled to Medicare by the end of this year. New enrollees to Medicare next year will not have the option to buy an F plan or a C plan for their supplemental benefits. They have done away with them all, and I did read that it's because Congress said that they shouldn't be covering, no plan should be covering the $185 deductible.
What a stupid reason.
I was like, yes, it was so stupid. So that's what I read, so that's why they've stopped all, so there are no supplemental plans that will cover your Part B deductible anymore. But G is still there. G is also going to offer a high deductible plan. Like F had a high deductible, so G now will have a high deductible, which means the premiums will be lower. You're gonna pay the first $2,300, I think, out of your pocket. And then once you do, then your plan would pay. It's like a catastrophic sort of coverage, so it's a cheaper premium to get care if you really need it. I have asked everybody about these plan options because I know people are gonna ask me during open enrollment. So I don't have any prices for those new plans, the G high deductible, I don't even know who's selling it. I do know that it's offered, that's all I know. And I do know people new to Medicare won't be able to buy an F plan this year.
But if you already have it, you still have it.
Oh yeah, yes, if you already have it, Yeah, and my biggest concern was, okay, for the people that have it, are their premiums gonna go up? All these things, and the National Association of Insurance Carriers or something sent out this broadcast about how it was illegal for them to jack up the prices of the people that are still enrolled in the F plans going forward. I have paperwork on it if you have questions, because that was my biggest fear. My in-laws have the F plan, my mother has the F plan. I was very concerned that if they stayed, I assumed, because they've done away with other supplemental plans before. The J plan was taken away, and those folks had a special enrollment period to change their plan. I was very hopeful that the F folks would have the same option if they wanted it, but they didn't give it to them because they kept those plans the same, just stopped allowing newer members to enroll. I don't know how that benefits anybody, but that's what they've done.
But if for some crazy reason you wanted to change from F to G or something, could you?
You would have to go through medical underwriting, but yes, you can. I mean, depending on your medical history, you could.
Okay, well, I'm part F, I just want to make sure, I have part F, I just want to make sure that I don't have to change something.
Nope.
If I did it.
No, you could, they'll ask you medical questions unless you have a special enrollment or, well, yeah. They'll ask you medical questions. They'll determine if they want to cover you. And sometimes it's easier to start within your own company, the company that you're already with, to see if they'll cover you.
Well, if I don't have to, there's no reason for me to.
Yeah, you do not have to change your supplemental plan. In the state of Virginia, it is not, open enrollment is specific for the drug plans and the Advantage.
And that includes all of them, like Anthem and AARP and Humana, they all have to abide by that.
All the supplemental plans, yes, yep.
So what is the F plan? What's so great about it that they want to stop it?
Oh, it covers everything. It covers the $185 deductible for Part B and everything else that Medicare doesn't cover. So basically, you go to the doctor, you give them your cards, you don't pay anything else, as long as it's a Medicare-approved coverage.
So you
Yeah.
pay everything up front in your premium
Yes,
instead?
yes,
That's the difference.
yes.
And the premium.
The premiums are much higher than the G plan, and if you're comparing them, they are higher. Now, of course, the Part B premium will go up. It goes up every year. I'm assuming it'll go up some. I haven't heard. Medicare and the federal, they like to keep us on edge and waiting for these new numbers. Yes.
I thought I'd read a preliminary number that came from the CMS
Oh, what was
of
that?
144.30.
So it went
So it's
down?
up,
So it went down? The Part B
no, it's
deductible?
135.50, right?
Oh, the Part B premium,
Part B premium, yeah.
the deductible. Oh, so,
So I thought it was
So it's
going up
going
like
up
$8.
oh, wow. Wow. Yes, yes.
So there is basically a pre-existing condition if you want to try to change from, say, F to G. Medical underwriting, pre-existing condition.
Yes.
To me, it's all the same.
It's all the same, yes.
Yeah, I went to the Aging Expo over at Culpeper
Yes.
last week, and I've got her card, but I don't know the agency she was with. Well, she was really pushing Plan G, but she never mentioned, oh, by the way, you may not be eligible if you've got some, past medical conditions.
Yeah, yes,
Is that right?
I'm sorry.
Is that right?
That is right, yes, you can't, you can switch, anybody has the right to switch, but it's up to the plan if they wanna cover you. Because technically, you have, your Medicare is your health insurance, this is just a supplement, so it's out of the realm of the pre-existing condition clause through the Affordable Care Act.
With the supplemental plans, at least with United Healthcare that we have, when I joined, there was a 3% discount each year for the first 10 years. So that was a big savings.
Huge.
Now, when my wife was on the phone, she wanted the exact same thing. Luckily I was right beside her and I said, ask them if there's a discount for 2. Well, they didn't offer it, but, they say, oh yeah, it is. So with her plan, she got 12 years at 3% discount each year. It starts out at 36%, then the next year is 33, et cetera, like that. And actually the premium went down quite a bit for, rather than taking like 2 separate by combined, it went down a tremendous amount of money.
Yes.
And so we said, hey, that's great, I'm glad you're younger than me, honey.
And, so do they stop raising your rates at 75 based on your age?
They give you every year to get it, and sometimes they have, but just about every year they have so far, increased it in January,
Okay.
Yeah.
like, which is 6 months for us, at least for me. And, it's not much, it's a few bucks, but you have it there for a whole year, what you're gonna be deducted out of your checking account or whatever you wanna do. But, I'm not sure about, I'm gonna have to find
Ask
out
them.
if it's for me at 75 or I can go to 77.
Okay.
That I don't know.
Ask, because
Yeah.
it's my understanding, AARP and Anthem, those two plans have told people that have told me, I haven't found out from them, they have told me that they will stop raising their rates based on their age at 75. They'll still go up for cost of living, but it won't go up twice, like cost of living and your
Right,
age.
right.
So it is really important to ask your plan. Say, look, I'm planning for the future. What are we looking at? Is it gonna stop going up at 75? But I have heard AARP and Anthem are the two that people have told me about.
That's my understanding of the
Oh,
AARP.
good. Oh, thank God, okay, thanks. I've been telling people that for a long time, so I'm hopeful it's right. But ask.
Yeah, I kind of, unfortunately, I kind of got lucky. 6 months after I enrolled in Medicare, I had quadruple bypass surgery. And 5 months later, I had to get a stent because the widowmaker went flat. And then, knee surgeries and hernia, I paid nothing. So I'm just thinking, are they ever gonna get their money back?
And you don't have, thank God you don't gotta worry about that.
That's right.
They got it from me.
They'll get it back some other way. You don't worry about that. That's good coverage. Yes, this lady had a question.
For Part D, for prescription,
Yes.
we learned the hard way, but for 5 years after I turned 65, I was not on any prescription meds. So I thought, why should I pay it? However, once I got on a prescription med, I'm now on 3, I have to pay more than the average because they want to make up those 5 years.
Yes, there is a penalty, yes.
I'm penalized every month by $13 or $14 more than my husband is paying.
Yeah. Yes, if you don't enroll in Medicare Part D, if you don't have a drug plan of some sort, when you have Medicare, they will penalize you when you do enroll.
However,
It's heartbreaking.
I don't pay anything extra for my 3 medications.
Oh, good, you have zero copay for your meds?
0 copay.
Good, oh, that's a good
So
thing.
that's a good thing. That's for free.
It sort of
And
evens
that's a
out.
3-month supply.
Yeah,
I get a
yes.
Exactly.
Excuse me.
What drug companies?
We use Optum RX. It's a mail order, and they're wonderful.
Who?
Optum RX.
Optum.
But that's not a drug plan. Who's your drug plan with? 'Cause
United
that's the-
Healthcare.
Yeah, United
Our-
Healthcare.
Who?
Yeah, United Healthcare
Oh,
through our,
United Health.
yeah.
Yeah, sometimes
So
the
that's a
drug,
good thing.
the-
I was all ready to switch to this Advantage plan, because I've got all these things from Mary Washington. But I talked to somebody at Medicare this morning, and she said, it's okay, but you have to understand, and we checked all of our doctors, and they are in the plan.
oh, good, good.
However, we also have a doctor we see down at UVA. And so you'd have to pay that out of pocket if you go to an urgent care, emergency room, or admitted into the hospital. Those are all extra co-pays that they don't pay through the Advantage plan.
Oh.
However, it doesn't seem like it's that much when we're putting out $463 a month for the extended, the supplemental.
Yeah, yeah, I know, it's a private, I like that everybody's, it's a private thing that you have to figure out what's best for you. And unfortunately, insurance is something you're insuring for the future that you don't even know what's gonna happen in the next second.
We had United Health, well, I had United Healthcare prescription plan.
Mhm.
And first couple of years, it was very affordable. And then, I forget, 2 or 3 years ago, boy, it just raised like $40 a month.
Yes.
So then luckily, this lady came over and she was talking to my wife about, getting into, I guess it was Obamacare at the time. She wasn't out of Medicare. She said, yeah, look at Humana prescription plan. So I did, it was only $18 a month. Now, it went from 18 to 21 to 26, and now the new one is 54.
Yeah.
But, I do the 3 months, and 2 of them I pay 0, and 4 of them I pay $8 a month, for a three-month supply. Well, whoopee, I'm not gonna pay anything for any of them. So I'm just gonna say maybe like 2 months premiums,
Yeah, and a lot of times with the generic medicine, if you're on a really, like losartan or, not losartan, Lipitor, no. I can't even think of one right now.
Losartan is a tier
Yes,
one.
lisinopril, all those, yes, the little, thank you, God, I'm like, why can't I think of these meds? Usually they're like in my head all the time. So if you have those really inexpensive generic medicines, you probably shouldn't have a high premium, and I promise you, you probably can get a cheaper one than 54, or because the $13.20 plan probably will cover your generic medicines. I would bet. I don't know because I haven't looked at them, but I would bet that they would. And it's silly to pay more premium for a plan that might not be here next year anyway, and then you can look again for another plan. A lot of times they get you with the premium. And it used to be back in the day before Part D started, the supplemental plan was the only place you could get a Part D plan. Like you could only get prescription coverage like through Anthem or AARP or one of those companies. Well, when I finally started doing this and met with people, they were paying sometimes $80 a month for premium for like those really cheap generic drugs where we could save them $70 by getting on a plan that's $15 a month and your generics are still covered. So that's why it's so important, even though you might love your plan, you might be, if you want to save money, I behoove you to look at the plan finder or make an appointment just to make sure that there's not a cheaper drug plan for you, because there can be savings found. It's just, you gotta look, and it's so many variables. It's your meds that you take, the pharmacy that you choose. Sometimes mail order's better, sometimes it's not. So it's really important to look and know what you're looking at. So I'm really happy that we can help you if you want for free, which is great. That's a good free thing to get. Yes, ma'am.
I'm 5 months older than my husband, so I signed up for Medicare first and got my supplement plan, and then we decided the same plan would be good for him, so he signed up 5 months later. But we're not signed up as a couple, we pay separate. Is there an advantage, not for Medicare, but for the supplemental plans? Someone would say there's an advantage to going in as a couple?
Sometimes, well,
I mean, they know we're married.
Yeah, and they usually, if they know you're married and you have the plan together, they should be giving you the discount automatically. You can ask them.
Should it be one premium, or, I mean?
No, two. Everybody that I've met pays
Okay.
twice.
No, I pay one,
One for two people?
yes.
Oh, okay.
Yeah,
Well,
Who are you with?
same here.
With United Healthcare.
Oh, so am I, but we pay twice, I mean, we pay separate.
Oh.
But I guess I need to ask them,
Yeah.
can we pay? once?
yes,
Oh, that would-
yeah. Wouldn't that be helpful? I didn't know that.
That would
Thank
be-
you. Thank y'all. I don't
That's
know.
what we did, and I think it was like maybe $200 a month by us both going on the same plan. It was quite a significant,
A supplemental plan.
yeah, the supplemental, yeah.
I would call them and ask them.
I will, I'm gonna ask.
Yeah, yes, call them and
That's
ask
what we
them.
did.
Yeah.
Yes.
But we
You
had
may
all of
have
our
said this,
pre-existing
but-
conditions before we turned 63.
My husband's already on Medicare. When I get on Medicare, can I go on his supplemental?
No, but you can buy one of your very own.
The Part F?
Yes, no, wait.
Right, he's got a good plan.
You don't have Medicare yet?
Yeah,
Oh, yeah, no.
I'm stuck with whatever. I
You're
can't
stuck
go
with-
on his policy.
No.
I have to go get my own, whatever's
Yes.
available at the time.
Yes, but you can go with the same company if they offer it, because if you go with the same company,
And
that's
then
where
pay
you get the
bill.
discount.
I see. Okay.
That, yes, somehow, some plan. Well, AARP should be giving everybody the same discount. You
Well,
would think.
well, my husband, his premiums are lower than mine, so maybe that's how they're giving us a discount.
Maybe. I would ask them, just so you
Yeah, I
know.
will.
I would want to know.
One more question.
Yes,
You mentioned the new Medicare card.
yes,
You're talking about the one that does not have Social Security. So if you got those
Yes.
cards 2 years ago and they don't have a Social Security number.
yes. Was it
We
2
should-
years ago that they
Yeah.
came? Oh my gosh.
Time flies.
Flies.
Yeah,
Yes,
because I've never
same.
had my Social Security number, well, not quite, maybe not quite 2 years, I just turned 66, but,
That's the one I'm talking about.
okay, so I shouldn't be looking for a new
No.
card. Okay,
No,
The one
no,
that's got
no.
letters in it.
right.
Oh, God.
Okay.
Yes, ma'am.
I'm like,
Yes,
oh my God,
no.
they're sending out everybody.
Can you,
It's like the real
say
ID.
on the basic Medicare coverage, and then, I forget what that's called, but, and then sign up for like dental and vision, as a separate policy?
Yes, yes, and I have all the dental and vision plans available, sold through the state, they're over here. And yes, you can definitely add your own benefits to it. Even the plan, the Humana has the plan, Anthem has a plan, MediBlue. A lot of companies do have the plan where they cover dental and vision. You can add on any of the ones that you want. There is no open enrollment time for that. You can do it at any time. Yes, yep. Definitely get a drug plan if you don't go with an Advantage plan. Because the drug plan, you'll get penalized when you least expect it. And because of all the advertising on TV last year, I swear I had more people who had never had a Part D plan. Some of them in their 80s decided, okay, because they were so worried about all these chemo drugs that they're advertising on TV, that they wanted to come in and buy a plan. The plan premium was less than their penalty that they were paying. They still weren't taking any medicines, but they were so worried, and so they went ahead and enrolled. And so, yeah, I don't understand why they think penalizing people is the way to go, but that's what they do. So, yeah, everybody make sure you have a drug plan if you need what you've had done, so you can look back 3 months and say, oh yeah, I did go there and I saw them. One thing I've also noticed with doctors is they're outsourcing with each other's billing offices. So you have to be really, you have to know who you've seen, and sometimes like Blue Ridge does Fauquier ENT or vice versa. And so you have to call them. If you see something on this at all that does not seem right, like I didn't go there, call the billing office, make sure that it's right, make sure it's a right bill, a right service, because you don't want to pay more. And even if you have a supplement at the end of the day, Medicare fraud makes us all pay more, Medicare and Medicaid fraud, so it's so important to be diligent of what you're having done and make sure they're billing you correctly. Who asked for this? Thank you. I have a couple more. And if you come in and see us, we might have more of these in the office. They're supposed to be sending us new ones of these with the new card information, but I love these guides, so they're very helpful. And Jenny, who is not here today, but Jenny, who is the Orange representative, also knows all this information and has the same access to everything that I have here today. So,
Anything else? All right, thank you.